Hi guys, Dr. Bobby Striker here with rescue.sg, and today we're talking all about the coronavirus, which seems to be everywhere. The COVID-19 infection has been officially declared as an international pandemic by who? By who? The World Health Organization, which means that it's pretty much everywhere. So it's not an epidemic in one country, it's an epidemic which is spreading in multiple countries simultaneously, hence an international pandemic. So what does that mean? Well, it doesn't mean that you should do this. So if you do that, that results in this. Now, I'm sure nobody wants this to happen, okay? There are people in our community, and we all need to work together to look out for one another to prevent this from happening, okay? If you go out and panic buy, and you go and buy all of the hand soap, all the sanitizers, all of the face masks, think about what happens. You will have really clean hands, great, good for you, but all the people around you are going to have really dirty hands because they don't have any hand soap or hand sanitizers. And then when they cough and stuff, because they don't have any masks, there's going to be droplets everywhere. Inadvertently, you've actually probably increased your chances of getting the COVID-19 infection. You see that? So we need to work together to stop this from happening, okay? And I'm going to try to highlight as much as I can in this video to really try and make it a definitive one-stop video, the only video you need to see to cover everything you need to know about coronavirus. Unless, of course, we do another video, then you should watch that too. Okay, so we've been asking all our fans and friends to send in messages, see if we can try and answer them, and that's what we're going to do. So let's get straight into it, to our first question. So the first thing we're going to talk about is, what is a coronavirus? And why does the name sound like a beer? Okay. Go away. Serious stuff. Okay, so coronavirus and corona beer, let's get that out of the way. They share no similarity other than the name. You know, the word corona comes from the Latin word meaning crown, and because the coronavirus family of viruses, they appear like crowns. You know, they have this appearance with spikes sticking out, so they were labeled as the coronavirus family. And they're pretty common, so when you get a normal runny nose, cough, sore throat, a common cold, it's often due to coronavirus infections, you know, about 15-20% of the time. However, there's many types, and now there's three types which are pretty bad. There was the MERS, Middle Eastern Respiratory Syndrome, there was SARS, Severe Acute Respiratory Syndrome, and now there's COVID-19, okay? Of the three, COVID-19 appears to be the milder version, the less aggressive version, and it may not seem that way because it's spread to so many places, but let's think about that a little bit. If the virus was so aggressive and so dangerous that it made you incredibly sick, and there are viruses that do that, you become so sick so quickly that you die, or you become bedridden and you're admitted into hospital because you're too sick to do anything, to move, then you won't be able to travel. You won't be able to go anywhere, and the virus spread would be quite limited just because it's so severe that the host, us, and organisms, we can't go anywhere and it can't spread. And there are viruses like that, like Ebola and some of these other really strong and crazy viruses. With the COVID-19 infection, what happens is that the symptoms are often quite mild. Yeah, sometimes they're so mild that you don't even notice. It feels like you've just got a cold. There are even now patients who have no symptoms. As a result, you can get on a plane, you can travel around the world, and suddenly, you know, the virus is spread to a whole different continent. And because it's a milder infection, it gives it an opportunity to spread further, and it's carried further. And that's why it appears severe, because the spread is so great. But if you think about it this way, then it's quite clear the spread is significant. Because it's a milder infection, patients have not been so sick that they couldn't travel. So they've traveled, the virus is spread, and now it's spread all over the globe pretty much. So the volume of patients, of course, is much higher. And of course, if there's going to be much more volume of infected patients, unfortunately, the volume of patients that die is also going to be higher, but that doesn't mean it's because this virus is more deadly than the others. If you look at the actual mortality, it's still only about 2 to 3% compared to some of these other viruses, even comparing to other coronaviruses. So that's a good thing, okay? So that's what a coronavirus is. Unfortunately, the symptoms may be very similar to a common cold. So you might get a cough, runny nose, sore throat, body aches, fevers. But the thing that differentiates it, the worrying symptom, is breathlessness. Yeah, if you start to get breathless, that's when we worry whether you might be developing a pneumonia, which is not so common with these other types of infections, with a common cold specifically. So that's the main differentiating factor. We had a question come in asking, what is the fever at which you should be concerned? Well, that's the thing. Not everyone with the coronavirus, with COVID-19 infection, will get a fever. In fact, there are some patients who have no symptoms at all. Or some patients who have such mild symptoms, they think they've just caught a cold, and after a few days they've actually recovered, and they never get all of these other worrying symptoms. Now, the worrying symptoms are specifically breathlessness. So remember, you may not get a fever. So it's not the severity of the fever which is a concern here. It's whether you might be developing pneumonia. So pneumonia is a type of chest-lung infection where your lungs start to fill up with fluid and pus, and it's basically almost like drowning from inside out. And that's why it can be so serious. So who gets these infections? So that kind of leads us into our next question. Well, no, it doesn't. It actually affects everyone. Okay, it can affect any age of patient. There are now cases affecting babies and children, and of course, those who are more vulnerable. So the older patients are generally more vulnerable because they might have other health issues, things like heart problems, lung problems, kidney issues, circulation issues, and that really is going to dictate the severity of the illness too. How healthy you are initially, before you have the infection. If you are really healthy before you got infected with COVID-19, then your chances of having a good outcome and not having such a serious illness are much higher. If your health was already not great, if you've already got a lot of lung issues, if you smoke, you've got heart problems, and you're generally quite unwell, and then you get the COVID-19 infection, then of course your outcome might not be as good. You might get the pneumonia version. You might end up being hospitalized. So it's not so black and white that it only affects old people and not young people. You have to look at the whole overall health of the individual, and that's really going to be important when we decide, what your risk might be, whether the prognosis for you will be good or bad. And so you can get a young individual who might have a really severe course of the illness, and you might get someone who's really old, like 90 plus, who doesn't have any health issues and recovers really well from a COVID-19 infection. So that's something to take home. That's why it's important, regardless of your age, regardless of your health, we should all be taking precautions to try and minimize our chances of getting this infection. That's really important. Actually, there is no specific active treatment. Treatments are supportive. So if you are admitted with COVID-19 infection because you're getting pneumonia and you're getting breathless, you can be given supplemental oxygen through a mask. You can be given IV fluids to rehydrate you. These are all measures to try and support your recovery. And how good that recovery will be, like I mentioned earlier, really depends on how fit you already were before you were infected. So if at the time of infection you were already unwell due to other reasons, then of course the chances of you recovering well are going to be much lower. So at the moment there's no specific treatment, though there are being trials done on using certain existing medicines like HIV medicines. HIV is also a virus, so there's research being done on how effective using those kinds of antiviral medicines might be for this COVID-19 infection. There's also been some success in China using plasma exchange, changing components in your blood to remove the viral particles and things like that. That's still being researched. And of course a vaccine. We need a vaccine, and the vaccine, I believe, have already gone into human trials, and if we're lucky, I know people are saying it might come in within the next few months. Realistically, most vaccines would take about a year or so to hit the market because we need to make sure they're safe. We don't want to give you health issues with the vaccine which has problems, okay? you might be thinking, okay, so should I go and get a normal flu vaccine? Yeah, you probably should. I mean, the normal flu is still out there. Don't forget, other infections and illnesses are definitely still out there. So protecting yourself against a normal flu is a great thing to do. But a normal flu vaccine, a quadrivalent flu vaccine, will not protect you from getting the COVID-19 coronavirus infection. Okay, so the other thing to take note of in terms of the treatment of COVID-19 is that a lot of people get really mild symptoms. You know, you might just have a slight sore throat, runny nose, these kind of symptoms, and you don't actually feel that unwell. And to be honest, that's probably going to be the majority of patients. So if you have these kind of symptoms, you might not need any active treatment, and you can probably just self-isolate at home and you'll recover. And that's the practice in a lot of countries, just self-isolation at home to minimize the risk of spread to the community, and they just let it take care of itself. Of course, if you're older and you get breathless, things like that, that's where the treatment is necessary. But that's the important thing. Don't think that if you get coronavirus, COVID-19 infection, you're going to die. You know, remember that the majority of you, the vast majority of you, you will probably have a very mild run of symptoms, and you may recover completely well with no treatment whatsoever. Probably not. I mean, there's not really been any conclusive evidence that that's possible, though it's probably more likely that you can spread it to your pets. So please don't go and throw your pets out of the window and things like that. Look after your pets. They won't spread you the infection. Take care of them, okay? Well, actually, not really any of them. I mean, if you really had to pick one vitamin supplement, I would probably suggest vitamin D, just because it's so important in terms of our immune system, and because a lot of the developed world, we just simply are not going outdoors as much as we used to with indoor jobs and desk-bound jobs, and a lot of cultures prefer to avoid too much sunlight to stay fairer, but inadvertently by doing so, you're probably going to drop your vitamin D levels, and that will drop your immunity. If you actually look at countries where there are seasons, during the winter, darker seasons or shorter days, patients often get something known as SAD, seasonal affective disorder. They actually get sad, literally. They become unhappy, and the immune system weakens. And guess what? They often get flu, and hence you get this kind of seasonal flu season too. So are the two related? Possibly. It's not concrete and not 100% confirmed, but there's definitely a possibility there. So boosting your vitamin D with a supplement could be helpful, but it would be probably better for you to get some blood work done to see whether you really need it or not, though. And do check out our website. We've done a full kind of post about vitamin supplements, what's good for you, what might help you. So it's not really hardcore evidence that vitamin supplementation is going to make you feel better and protect you from COVID-19 infection. But if you really had to pick one vitamin, then over vitamin C, I'm going to have to go with vitamin D on this one. Why are you guys not washing your hands? It's the single most effective thing you can do to protect yourselves from infection. I mean, I would have hoped everyone would have got that message by now, okay? But unfortunately, when I'm out, I'm in uniform, people can see I'm a medical professional, and yet there's obviously, it doesn't matter, people are still not practicing hand hygiene. I see guys in the washroom, they will wash their hands sometimes before they do the business. Well, it doesn't make any sense. Some guys are even putting their hands in the urinal to use the water to clean themselves, but then they're not washing their hands afterwards. So you're kind of defeating the purpose there of the procedure. I mean, you got to wash your hands. It's the simplest thing you can do. Get onto that. Do it now. Why are you guys not washing your hands? Start washing your hands so you don't get COVID-19. So this guy doesn't get you, isn't it? Go. Go away. Yeah, you got to get rid of this guy. Okay, so hand hygiene, extremely important, which leads us on to the next question. In all honesty, they probably do. Now, there are a few different types of masks. The most common type of mask will be the 3-ply surgical mask. Now, this type of mask, it has kind of 3 different layers. You have like an outer water repellent layer, an inner kind of filter layer, and then the innermost layer is an absorbent layer. So someone's crawling in to pass me a mask here. Okay, thank you, Juliana. All right, so here we go. So this is a 3-ply surgical mask. So you see here the blue surface. This is a water repellent surface, and in the middle layer is the kind of filtration layer, and then the innermost layer, the 3rd layer, that's the absorbent layer. So when you wear this, what happens is that droplets in the air, they will kind of be blocked at this water repellent surface, and when you're breathing the air, it is filtered through that in the middle filtration layer. And then if you're wearing it, the kind of absorbent layer on the inside, that's going to absorb droplets and things that you're breathing out. So if it's effective, and if it does offer some protection, it's not 100% protection, but it will definitely offer a little bit of protection, then why are we not recommending everyone wear a mask? Well, to be honest, there's just not enough of them to go around, you know. If you look at healthcare professionals, so when I was in the Singapore polyclinics, we actually would have a designated flu cluster, meaning they would streamline patients with flu, cough, fever, runny nose, these kinds of symptoms. And there were, I believe on one day I saw 117 patients. And that's not even the most. There are guys who saw 150 patients, but that's the volume of patients I'm seeing with fever, cough, runny nose, and all of those symptoms. And when I was sitting in those clusters, if I was wearing one of these masks, it definitely offered me some protection, because I remember clearly those days where I, perhaps out of laziness or whatever reason, I wasn't wearing a mask, I felt sick really quickly afterwards. You know, I'd get all the symptoms too. So it definitely offers you some protection. And similarly, if you're sick and you've got a cough, runny nose, and you can't self-isolate at home, you really have to go out. And if you're wearing a 3-ply surgical mask, that absorbent layer on the inside, yeah, it will help. It will absorb some of your droplets when you breathe in and out, when you cough and sneeze, to prevent people around you getting infected. So if there's not enough masks available, these are the people who need to be wearing them. So I'm not trying to create panic here. Masks do offer some element of protection. This kind of 3-ply surgical mask is not going to offer 100% protection. When you wear it, you see this, pull it down, okay, and you pinch it over the nose. There you go. It's still open at the sides. You're definitely not going to get 100% protection with that, okay? But it's going to offer you some protection. If you have these masks, you can use them, okay? But it would be better to give it to someone who might be really unwell, okay? Which leads us on to a more effective type of mask. So I can see Juliana crawling in to pass me this other type of mask. Okay, so an N95 respirator mask. So this is often used by healthcare professionals. It offers a lot more protection. It gives you a really tight seal around the nose, the mouth, and the face. And it's actually, to be honest, really uncomfortable. So you might be thinking, okay, great, I'll go and get some N95 masks. Number one, because so many people have bought them, they're really difficult to find. But number two, you actually need to go for mask fitting. There's different sizes, and for us healthcare professionals, we go through a process known as mask fitting, where we will actually put on different size masks. They will then put something over that, then inject a spray, and if we can still smell the spray, that means the mask size is wrong, and you have to go through this. So just buying some N95 masks is not going to offer you protection, and again, by hoarding these kind of masks, you may be preventing people who really need it from being able to find them, okay? So it goes back to what we mentioned earlier, hand hygiene, yeah? Washing your hands, basic hand hygiene, before and after entering a building, after going to the bathroom, just getting it into your routine to make it as much a part of your daily life ritual as possible, just washing your hands with alcohol, with sanitizer, with water and soap. Again, check out our other video and on hand washing and hand sanitization to know how to do it properly to really get maximum, germ eradication from your hands. But it's really important. And if you do good hand hygiene, but then you just don't, you disregard your overall general health and your hygiene practices, it's really going to be a weak link, and you're still going to fall sick. And I'll see people washing their hands, then they go back into the toilet cubicle to tear off toilet paper to dry their hands with it. Does that make sense? Those toilet rolls are probably full of poop particles, and I've even seen guys using those toilet paper to then wipe their faces. Yeah, really good idea. In case you don't get it, I'm being sarcastic there. It's a really bad idea. Please don't do that, okay? And on that note, I really want to pay my respects to all the hardworking staff out there that are cleaning premises, cleaning surfaces, cleaning our bathrooms, our homes, our work environments, making them safe for us to work safely. If not for them, it would be a much bigger disaster than it is at the moment. It would be a much more severe pandemic. We know that the virus can survive outside of a human host. How long, we don't know. But through their efforts, the infection risk is probably much lower. And they've probably saved much more lives, much greater volume of lives than I ever could. So I'm really grateful, and my hat's off to all of you guys out there. The hospitals are doing nasal swabs, so that's how you take a kind of like a long cotton bud, put it in through the nostril, take a sample, send it for analysis. You're getting the results now faster and faster, though typically there were about 24 hours or so turnaround time. I believe they're even cutting it down to a few hours. So that's how they're diagnosing. But the question specifically was what's happening in the GP scenario, GP clinics, because, of course, they're encountering a lot of patients with cough, cold, runny nose symptoms, but they don't seem to be having the facility, the resources to do this kind of testing. Well, the reason for that, if you think about it, if you come to a GP clinic and you get yourself tested, then you go about your activities as per usual. While waiting for that result, you might be traveling around who knows where, then the result comes back positive, and then, you might have spread it to loads of people. And because of that, MOH is very clear, for suspect cases, we don't bother to test in the primary care setting as a GP or in those family clinics. Patients are simply referred to a place where they can be formally tested for proper diagnosis. And the suspect case definition, that's been provided by the Ministry of Health, you can check out the website, it's pretty clear. If you've got signs and symptoms suggestive of pneumonia and you've traveled to any country outside of Singapore within the last 14 days, you are considered a potential suspect case for COVID-19 infection. Or the other category are patients having upper respiratory symptoms, meaning like cough, runny nose, sore throat, feverish kind of symptoms of any degree of severity, even mild symptoms, but have traveled to at-risk locations within the last 14 days, or have been to any hospital overseas, or have come into close contact with a confirmed COVID-19 infected patient. These are also considered a suspect, fulfilling suspect case criteria, and these patients would also require referral for appropriate testing and then management as necessary. So rather than wasting time, because we want to keep things under control, keep it tight, patients who might be even suspected to be a case of COVID-19 infection, rather than waste time, we are just sending them in to the appropriate places to get tested, which is more often than not the emergency departments in our hospitals. So that's the process, and that's the reason why if you're traveling as a patient, you're going to multiple GP clinics, the connection might be lost. The one clinic might not be connected to another, and they might not know the full history. It's quite important that you follow up with one clinic so that you can be advised appropriately and they're fully aware of what's happened to you, how your illness has progressed. But bear in mind, given the current climate, even if your symptoms initially started minor, you were treated for a minor cough and cold, which is probably quite appropriate. If you start to get breathless, then be sensible. Get yourself into the hospital, get it checked out, see a doctor again, seek further medical attention. So I hope that gives you some idea on the approach from a medical perspective in terms of diagnosis. What else can we do to protect ourselves? You might have heard of it already. There's something called social distancing. Now, to be honest, I'm not a big fan of that term. I'd rather consider it physical distancing, okay? Because we should be showing social solidarity. We need to come together as a community to do the right thing. But of course, being sensible, maintaining physical distance. And the guidance has been roughly, keep about 6 foot distance between yourself and others. If you really have to go out, of course, the best thing is probably to stay at home. I mean, this is as close to a movie as we've probably had. You've seen outbreak, you've seen contagion. This is happening now. And a lot of people are out there living their lives as per usual. And of course, we don't want it to destroy our lives and our livelihood. But at the same time, we've got to be responsible. There is a significant threat to our well-being globally at the moment. And one of the easiest things you can do is to stay at home. Yeah, if you are unwell with mild symptoms, again, stay at home. Protect yourself and others by doing so. Minimize the risk of spread. If everybody is staying at home, these viral particles have no host. They're not going to survive for too long out in the wild with the wind and everything blowing it away. Without a host, these viruses cannot survive. So if you are trying to protect yourself, that's probably the single most important thing that you can do. Stay at home. Let the medical professionals go out to help people where needed. You can really help us, and this will contribute to also minimizing the risk of our healthcare facilities being overwhelmed. If everyone was out in the community mingling as per usual, spreading the infection possibly to one another, then you can imagine quite rapidly that infection potential could increase and rapidly escalate in our countries and overwhelm our healthcare facilities. So I'm not trying to create panic and fear. I'm trying to show you the importance of having some physical distancing in communities, in societies, still show social solidarity to look out for people who might be vulnerable, who might not be able to take care of themselves. Check out on your neighbors, see are they okay, are they equipped, do they have food, were they able to get toilet roll because everyone's bought all the toilet roll for whatever reason. Look out for one another, but be sensible, keep a physical distance. If at all possible, stay at home. Don't go out for non-essential activities as much as possible. A lot of people might be afraid, you might not be feeling unwell, but you don't want to be hospitalized, to be labeled, but you've got to do the right thing. And the time for being selfish, unfortunately, that is the best word to choose here. The time to be selfish is gone. If we want to get this situation under control as quickly as possible, we have to think about the greater good, and that is for everyone. And so if you are unwell and you've had contact or you've been overseas, don't continue about your daily activities. Stay at home, seek medical attention, go and get medical help, get yourself tested if necessary, if it's advised to do so, and get it dealt with. Don't be afraid. I would be more afraid if you fulfill the case suspect definition and you don't get yourself checked out and you stay at home and you get really sick. So get advice, get help, and of course, if need be, you can even get in touch with us. Sure, you guys are all familiar with us by now. We're a home visiting medical service. So if you are too afraid to visit your family clinic, you have mild symptoms and you do not fulfill the MOH suspect criteria, and you're having a minor illness, then definitely we can come and see you at home. You don't even have to leave the comfort of your home to get the treatment you need, to get the medicines, get the MC, whatever's clinically indicated for your case. If you fulfill MOH criteria, either give us a call your regular family doctor, seek medical attention. They'll advise you what to do. Visit a recognized institution or your local emergency department. Stay on top of the updates through the MOH website and through appropriate approved media channels. And feel free to check out our social media pages too. So I think that's about it, guys. I've been talking for a really long time, so I hope I've covered most of the important things in relation to COVID-19 infection. It's here, and to be honest, even if we get on top of this, it's not going to be the last virus we're going to see. You've seen the trend now. Every few years there's going to be a new virus appearing. It's Mother Nature's attempt to get back at us for destroying her or whatever it might be. So let's do our best, come together as community. We can get over this, but let's also use this opportunity to do right, and hopefully the planet and all of us, we can all heal together. All right, guys, so take it easy, stay in touch, look after one another, and we'll catch you next time in the next video. And that's it. Bye-bye, coronavirus. We hope we never see you again. Laters. No, I said I don't want to see you again. Shoosh. Out of here. Bye, guys. And you may recover completely well with no treatment whatsoever.